Well, Fox Carolina News going in depth right now on the Senate race for 2026. Several people running to unseat Senator Lindsey Graham. One of those is Democratic candidate Dr. Andy Andrews. So, Dr. Andrews, thank you so much for taking some time with us. Looking to unseat Senator Lindsey Graham in his seat. He's been there for quite a while. But South Carolina has not elected a Democratic senator since 1998. You see those odds up against you, you're still in the race. Why is that?
Well, 1998 wasn't that long ago, and the issues South Carolinians are facing, whether you're a Democrat, a Republican, or an independent, the damage that's being done by this Trump administration, enabled by South Carolina's Senator Lindsey Graham, is hurting real South Carolinians. So people are looking for a change. He's been in the U.S. Senate for 22 years and has really failed on every objective measure. His current approval rating is 34%, which really tells me South Carolinians are looking for a choice, and they're looking for a fighter who will go to D.C. and fight for them.
President Trump has already said Senator Graham is his guy. He's given his full endorsement already, and South Carolina heavily went with President Trump. So how can you counter that perspective when talking to voters where you see those numbers voting for President Trump standing there saying, Lindsey Graham is my guy?
So, you know, the same people who are hearing that, they're the ones whose health care is being taken away. The Trump administration and Lindsey Graham have gutted our nation and our state's Medicaid program. Medicaid is the largest insurer for children in South Carolina. It funds 50% of the births in this state and 6 out of 10 nursing home beds. And I'm a pediatrician who's worked in hospital systems for my entire 20-year career. And I understand that when you rip health care away from that many people, it's going to harm all of us. So many South Carolinians already have a hard time accessing affordable, quality health care. And what Lindsey Graham is doing with Donald Trump is making our health care system worse. And so again, I think voters are looking for a change, and that's exactly what I'm offering them this cycle.
I want to get more to the healthcare system in just a second, but you ran against Congresswoman Nancy Mace in 2022. What did you learn from that defeat that you're taking with you across the state?
I learned that it's really important for voters to have a choice, and it's important for people to stand up and speak out when we're seeing the norms of our federal government erode every day. And let's make no mistake about it, Lindsey Graham is responsible for that. And so I know that voters need a choice, just like they did in South Carolina's 1st District back in 2022. They need a choice in this election, and that is what I am offering them.
When it comes to the healthcare system, you mentioned that President Trump and Lindsey Graham, they're the cause of it, but all those issues go back much farther than that. We remember there was an effort to repeal and replace the Affordable Care Act. Now Democrats themselves are saying that things need to change. What changes in place would you like to see, if elected to the Senate, would you do to the Affordable Care Act? Would you keep it in place? Would you repeal and replace it? What's the move?
So it's important to talk about the principles behind the Affordable Care Act, because what the Obama administration was advocating for was actually a broader reform that would hold insurance companies accountable. And because of the Affordable Care Act, passed by Democrats and signed into law by Barack Obama, we now have coverage for patients with pre-existing conditions. We now have an elimination of lifetime caps and annual caps. We allow young people to stay on their insurance until they're 26. We have no copay birth control. That is all because of Democrats in the Affordable Care Act. What we need is to take further steps to remove the profit motivation from our healthcare system. And you do that by offering things like lowering the age of Medicare eligibility, or offering a public option where individuals could purchase a healthcare plan from the government, removing some of that insurance company profit motivation from the system. But if we want to be really honest with ourselves, Lindsey Graham is more interested in keeping his special interest groups, his corporate donors, for-profit insurance companies happy than he is in developing a system that works for more South Carolinians. He's had 22 years in the U.S. Senate to offer a better health care plan if he thinks one exists. Where is his plan? He doesn't have a plan. I am going to Washington, D.C. to solve problems, just like I have for every day I've stepped foot in a children's hospital. When I have a sick or injured child in front of me, I don't have a choice to play games. I have to solve the problem in front of me, and that's exactly the attitude we need to expect from our lawmakers in Washington, D.C.
Something else I want to ask you about. As a doctor, we are currently in the middle of a measles outbreak here in the upstate. When it comes to vaccines, Are you in favor of mandating vaccines?
If you want to send your child to public school, then you need to follow the public health recommendations from your state and county public health departments. As a pediatrician, I have seen the impacts of preventable infectious diseases when they run rampant through our community. The routine childhood immunization schedule that for decades has been recommended by the CDC and the American Academy of Pediatrics is safe and effective. We have enough problems in our healthcare system. We have enough problems in the state of South Carolina. We don't need to bring yesterday's diseases back. This is deeply irresponsible, and it's what happens when you put someone like RFK Jr., who is nothing more than a grifter and a conspiracy theorist, in charge of our nation's healthcare system. And we here in South Carolina can blame Lindsey Graham for that because he voted to confirm him.
When you look at the Democratic Party as a whole, I think, recently you had some wins when it comes to national races in Greenville County, 2 seats for Democrat. What do you want voters to know about the Democratic Party, where it stands right now? Is because I think a lot of people are trying to figure out who's leading the party at the moment.
So I think we need to get out of our partisan labeling and look for fighters and look for people who will serve who elected them to serve. And that's exactly what I am. We need to make voters aware that me as a Democrat, I will go to Washington, D.C., and I will fight to lower the cost of housing, to lower the cost of prescription drugs, to lower the cost of health care, to lower the cost of groceries. We have to attack this affordability crisis head on, and that's exactly what I stand for. In addition to working to fix America's broken healthcare system by fully funding our Medicaid program, by protecting and refunding Medicare, by protecting Social Security. These are not entitlement programs. These are programs that hardworking South Carolinians have been paying into their entire working lives and deserve to benefit from. I will fight for the people. Lindsey Graham is fighting for himself and for Donald Trump.
All right, Dr. Annie Andrews, candidate for South Carolina Senate. Thank you so much.
Thank you.
Now, we've also spoken with the 3 Republicans currently in the race. That's Senator Lindsey Graham, his 2 challengers as well, Paul Dance and Mark Lynch. You can find those interviews right now on FoxCarolinaNews.com.